effluvium. Have y'all heard of this at all? No? So you probably heard of, oh, I was so stressed out, I had a new job, I had a baby, had something happen, and then a couple months later my hair fell out. Y'all heard of that? That's what this is. So it usually occurs 3 to 5 months after a stressor. So people will say, well, you know, my baby was born 6 months ago. That's actually perfect timing. Okay? It can take 6 to 12 months after the stressor is removed for the hair to grow back. It causes diffuse thinning of hair, and this is one that we want to make sure, you know, if it's something that's stressful in life, that's something you have to control, and perhaps there's medical help that can help you with that, but we want to make sure it's not something, a vitamin deficiency inside your body. It's not what I was talking about earlier with your liver being an issue, your kidneys being an issue, being anemic. So this is one that you want to seek medical advice if it doesn't seem like it's starting to let up. But this is not a permanent hair loss, it does grow back. Androgenic alopecia, I love Phil. So. But I put these two pictures up here because this is a man with hair loss. And usually men, their hairline starts to recede. They'll lose it at the temples, they'll lose it at the crown, and then it'll kind of meet in the middle, and they end up with a cul-de-sac type hair due like that. There are some women who experience this pattern, but it's most often in men. And then this is a woman with female pattern hair loss. You have some great pictures, she has hers out, have some great pictures of what this looks like in its stages as it goes along. This is another one that is not considered permanent in that the hair follicles remain. But if you wait long enough, the hair is not going to come back. Now, I say it requires lifelong attention because everybody goes, oh, well, you told me to use that Rogaine. Doesn't that mean I have to use it forever, right? Then everybody worries about that. Well, actually the answer is yes. So the reason why is if you stop using it, your hair just returns to where it would have been had you never used anything at all. So if you think of it like high blood pressure, diabetes, anything like that, if you stop taking your medication, your blood pressure goes through the roof, and your sugar goes through the roof. Now you have other issues. Well, think about it like, think about hair loss like that too. It's something that we have to maintain. And that's what Lisa's here to teach y'all today, how to maintain it from the outside. And I want to just stress that for these conditions as well. So this is another type of hair loss that I really want y'all to kind of sink in. It's not very well known by hairdressers, and it's often covered up for years, and then it's recognized very late. When I see women with this, unfortunately, I often see them where their hair looks like the back of my head, and they have no hair that's left. This is probably an earlier person here, and it's hard to capture a picture of it, but what ends up happening is exactly what the name says. Central, centrifugal, and cicatricial alopecia is one name. The other name is follicular degeneration syndrome. Literally, the follicles degenerate, they die, okay? And it starts in the center of your scalp, it works its way outward, centrifugal, and cicatricial means scarring. This is one that, yes, we can stop, but there are some things that need to be done in order to stop it. So it's another inflammatory disorder of the scalp. It can be associated with pain, itch, tenderness. If you have those symptoms and it's not explained by a bump on your head, then let's check it out, right? There's no reason for your scalp to itch all the time for you to kind of dig at it all day. There's no reason. There's no reason for it to just itch for no reason, okay? It's no good. We need to stop it. It's due to prolonged abuse of the hair. We are heating it up, and then we relax it, and then we put color on it, and then we style it, and then we put some gel on it, and then, we're twisting it sideways, and eventually our hair says, well, you don't like what I gave you, therefore I will not grow. And so stopping or at least slowing down on some of these treatments or some of these hairstyling practices will help, and some people just have to stop. It may require biopsy. I often do biopsies in my practice because when you come to me, you probably tried everything else. So, and I have people who have already visited Lisa, and they come to me with their hair piece. So, I don't want to waste time trying to give you medications, do an injection on your scalp, and then 6 months from now, you're like, Dr. Carter, it's still there. It's not working. We don't really have a good diagnosis. When I have a good diagnosis, I can let you know what to expect out of treatment. So other types of hair loss. Yeah, I kind of just put this other category up there just to let you know what's out there. This one, that's a kid with ringworm, right? And oftentimes ringworm, if it's just the dry stuff, dry scaly stuff, it'll grow back. We see this very often in our children, just because the shape of our hair allows the fungus to attach. For that same reason, the shape of our hair does not allow lice to attach. That's why we don't often get lice. Okay? This one down here is discoid lupus. This is somebody who has an autoimmune disorder. It has completely destroyed and scarred down the scalp. I cannot bring that back. So this is something we want to address on the front end. This is probably a man, because men get this more often, called folliculitis decumbens. They get all these pustules on their scalp, and they hurt, and they don't know why they're there. And it causes scarring alopecia and permanent loss. This lady, you can see she has no hair, no eyebrows. She kind of has we call it a lion-like face. And most people, and she has a cancer. What people think of with cancer is they think, oh, well, when you get cancer, you get chemotherapy, therefore you lose your hair. But there are types of cancers that cause hair loss as a primary issue. So if we treat the cancer, you can get your hair back. And this one, I actually have had a patient who saw probably 3 different dermatologists, showed up in my office. Her skin actually was gray. This isn't her, but her skin actually turned a grayish color. Her hair was falling out. She showed me a picture of her driver's license, and I said, no, this is not right. And now, hair's growing back, in remission, doing great. Okay? So when to seek help? Time is of the essence. Don't wait. Don't wait. Don't cover it up. Let's figure it out, and then you can cover it up, okay? So when home interventions are not working, or it's just progressive, it's not stopping, if you have any symptoms, scaling, itching, tenderness, pain, like you were saying over there earlier, we need to figure out what's going on, otherwise you'll continue to lose your hair. And seek specialized help. It's, you can always consult Dr. Google, right? So my mom said, she called me yesterday how she consulted Dr. Google for her broken finger. And I'm like, you have 2 doctors. So, but you need somebody who really understands you, understands your hair, understands your skin, understands what you need, and for you to feel whole. This is part of making us feel whole. And so, and you also don't want to consult somebody who has no idea, because a lot of these can be confusing, right? Didn't some of them look the same? I can tell you they all look different to me. But I spent years staring at hair. So this is ringworm. But doesn't it look a lot like that alopecia areata? That's lichen planopilaris. How different is that from traction alopecia? But the diagnosis and the prognosis, very, very different. Androgenetic alopecia versus that follicular degeneration syndrome look very, very similar. So, but androgenetic alopecia, we have something to do for that. FDS, CCCA, we're trying to stop what's going on and keep you, we may not be able to bring that hair back. And then, if you just have something that's strange, don't sit on it. I've definitely had patients, usually, often with lupus, who are like, well, I thought it was okay. I just put some hydrocortisone on it. My hairdresser said put a hot oil treatment on it, and it continues. So, I just want y'all to know when and where to seek advice, and what to do when you're seeking that advice. So make sure you have a good list of your medications. That handout, Lisa, I don't know if you'll let me use that handout. That's at the back of your. It has a lot of questions that I end up asking you during your visit. That's fantastic. It has all your medications, your medical history, what you do to style your hair. That's very, very helpful and very, very necessary. What you have to be honest about your hairstyling practices. I've had women who've sworn to me that they've never, ever had a chemical and haven't had anything for the last 20 years. And I'm like, really? Because that's just the way we style their hair. Almost. Come with clean hair. We want it to be clean so we can get through it. But don't necessarily wash the same morning. So sometimes we need to see what pathology is there. Hair counts and scalp samples, some people, they bring the skin pieces or they bring fragments of hair. It might be helpful for telling the difference between telogen effluvium and, say, breakage. But bringing in a packet of hair usually isn't that helpful. We usually have to do some different testing. And again, approach it like any other medical condition. Patience, it takes time for hair to grow back. You got to stick with the treatment, so persevere with it. You've got to be positive about treatment. Okay? So, if there's any questions, let me know. This is where you can find me. Yes.
Can you talk about menopause is hair loss?
Right.
Because I see that there's a lot of times.
Right, absolutely. So, menopause, we have two things. First of all, there's the hormonal changes that just may be going on because, like the androgenetic alopecia that I showed you. Then, when you have a loss of estrogen, you get, a lot of things do atrophy with that loss of estrogen. And so you can see overall thinning of the scalp, and it's actually very, very common. You can try minoxidil for it. There's one medication that I do prescribe called spironolactone that I tried. But is it, a lot of it's just genetic. So there's not a whole lot that we can do about that if we don't get on it pretty early and try the minoxidil